10 early signs of heart disease you should never ignore. Heart disease doesn't always announce itself with sudden, crushing chest pain. Sometimes the first clues are much easier to dismiss. A change in your breathing, unusual exhaustion, swelling in your legs, or a heartbeat that suddenly feels different. The important part is knowing which changes deserve attention. Many of these symptoms can have causes unrelated to the heart, but when they are new, persistent, severe, or happen together, they should not simply be brushed aside. Here are 10 warning signs worth knowing. 1. Pressure, tightness, or discomfort in the chest. Heart-related chest discomfort can take several forms. Some people describe pressure or squeezing, while others notice heaviness, fullness, burning, or an uncomfortable sensation in the center of the chest. It may appear during physical activity or emotional stress and improve with rest. This can happen when the heart muscle isn't receiving enough oxygen-rich blood, a problem commonly associated with coronary artery disease. If chest discomfort is severe, lasts several minutes, keeps returning, or occurs with other concerning symptoms, seek urgent medical attention rather than trying to determine the cause yourself. 2. Getting short of breath more easily. Pay attention to a noticeable change in how easily you breathe. If activities that used to feel routine, such as walking, climbing stairs, or carrying groceries, suddenly leave you unusually breathless, it's worth discussing with a healthcare professional. Shortness of breath can occur for many reasons, including lung conditions and anemia, but it can also happen when the heart isn't pumping effectively. Some people may also have difficulty breathing when lying flat or wake during the night, feeling short of breath. A new or worsening breathing problem deserves evaluation. 3. Discomfort that travels beyond the chest. Heart-related discomfort doesn't necessarily stay in one location. Pain, pressure, or unusual discomfort may spread toward the shoulder, arm, back, neck, jaw, or upper abdomen. The pattern isn't identical for everyone. Women, in particular, may experience less typical symptoms during a heart attack, including discomfort outside the chest, unusual fatigue, nausea, or shortness of breath. That doesn't mean every ache in your arm or jaw is a heart problem, but sudden unexplained discomfort, especially when combined with chest pressure, sweating, nausea, or breathing difficulty, should be treated seriously. 4. Persistent swelling in the feet or ankles. Notice your shoes fitting differently at the end of the day, or perhaps your socks are leaving unusually deep marks around your ankles. Swelling in the lower legs and feet can occur when excess fluid accumulates in the body. Heart failure is one possible cause because reduced pumping efficiency can contribute to fluid buildup. However, leg swelling can also result from kidney problems, certain medications, venous circulation issues, and other conditions. The key is not to assume the cause. New or persistent swelling should be evaluated, particularly when it occurs alongside breathlessness, rapid weight gain, or unusual fatigue. 5. A heartbeat that feels irregular. Your heart doesn't have to beat exactly the same way every second for you to be healthy. Occasional extra or skipped beats can happen, but frequent episodes of fluttering, racing, pounding, or an irregular rhythm deserve attention. One important example is atrial fibrillation, an abnormal rhythm that can increase the risk of blood clots and stroke. People with this condition may notice a rapid or uneven heartbeat, although some have few or no obvious symptoms. If palpitations are accompanied by chest discomfort, severe shortness of breath, fainting, or significant dizziness, seek urgent medical care. 6. Unexplained fatigue. Everyone gets tired. The more important question is whether your level of fatigue has changed. If ordinary activities suddenly require much more effort than they used to, or you're repeatedly exhausted without an obvious explanation, don't automatically blame stress or getting older. Reduced exercise tolerance can occur with cardiovascular problems, including conditions that affect the heart's ability to deliver enough blood to the body's tissues. Fatigue alone doesn't diagnose heart disease, but a persistent change in your energy, especially when combined with breathlessness, swelling, or chest discomfort, is worth discussing with a doctor. 7. Dizziness, fainting, or feeling lightheaded. Feeling faint can happen for simple reasons, such as dehydration or standing up too quickly. But unexplained or repeated episodes deserve attention. The heart plays a major role in maintaining blood flow to the brain. Abnormal heart rhythms, certain valve problems, and other cardiovascular conditions can sometimes reduce effective blood flow and lead to dizziness or fainting. Passing out during exercise is particularly concerning and should be medically evaluated. If dizziness happens together with chest pain, severe breathing difficulty, or a racing or irregular heartbeat, seek urgent care. 8. Loud snoring and possible sleep apnea. Your nighttime breathing can also provide clues about cardiovascular health. Loud, persistent snoring, especially when accompanied by pauses in breathing, choking or gasping during sleep, morning headaches, or significant daytime sleepiness, can be a sign of obstructive sleep apnea. During sleep apnea episodes, breathing repeatedly becomes blocked or interrupted. The condition is associated with several cardiovascular problems, including high blood pressure and increased cardiovascular risk. If someone who sleeps near you notices that you stop breathing during the night, don't ignore that observation. Talk with a healthcare professional about whether a sleep evaluation may be appropriate. 9. Nausea, cold sweating, or feeling suddenly unwell. A heart attack doesn't always feel like a dramatic chest emergency. Some people can experience nausea, vomiting, unusual sweating, weakness, or a sudden feeling that something is seriously wrong. These symptoms may occur with or without obvious chest discomfort. This can be particularly important for recognizing heart attacks in women, who are more likely than men to experience certain symptoms that don't fit the classic picture. If sudden sweating, nausea, weakness, or shortness of breath appears alongside chest pressure or other warning signs, don't wait to see whether it passes. 10. Erectile dysfunction. For men, erectile dysfunction can sometimes provide an earlier clue to vascular problems. An erection depends on healthy blood flow through the arteries. Problems affecting blood vessels can therefore contribute to erectile dysfunction, and cardiovascular risk factors such as high blood pressure, diabetes, smoking, and high cholesterol can affect both conditions. Erectile dysfunction doesn't mean someone definitely has heart disease, but unexplained or persistent erectile difficulties can be a good reason to discuss cardiovascular risk with a healthcare professional. And that's an important point about all 10 signs. None of them automatically means you have heart disease. The same symptom can have many different causes. What matters is recognizing a new or unexplained change and knowing when it could represent something serious. If you develop severe or persistent chest pressure, significant difficulty breathing, fainting, or symptoms that make you suspect a heart attack, don't wait for a routine appointment. Seek emergency medical care immediately. For less urgent but persistent changes, such as declining exercise tolerance, repeated palpitations, unexplained swelling, or ongoing erectile dysfunction, schedule a medical evaluation. Your heart doesn't come with a warning light on the dashboard. Learning to recognize changes in your body is one of the simplest ways to take cardiovascular health seriously.